Well, traumatic brain injuries, or TBI, are a major cause of death and disability. Texoma-Care neurosurgeon Dr. Abdul Baker joins us today to define TBI and to help us understand why early detection and treatment are so important for these types of injuries. Thanks, Dr. Baker, for being here today. First of all, we need to talk about what's classified as a traumatic brain injury.
Most people in our field would define traumatic brain injury as a manifestation of either symptoms or signs secondary to external force that is applied on the brain. Now, that can present itself as a symptom or sign, or as a radiographic finding in a CAT scan or MRI, because many patients who suffer traumatic brain injury may not be symptomatic at all, but only after you order certain images you find that diagnosis. On the other hand, patient may not have any abnormality on the CAT scan, but end up having symptoms secondary to injury to the head or loss of consciousness.
And let's talk about some of those signs that someone may be suffering from an injury like this.
So traumatic brain injury is classified as mild, moderate, or severe. The moderate and severe patients oftentimes are picked up right away because they often are brought to the hospital. We order certain images, either they undergo some sort of a brain surgery or a procedure to alleviate some of the symptoms as a consequence of the brain injury. The tricky part is the mild. Sometimes when patients have mild traumatic brain injuries, they choose to kind of not get any attention or treatment, and it can manifest with symptoms like headache, difficulty smelling, apathy, and significant number of patients have personality changes. You can have a person who's having a bubbly personality prior to the injury, and all of a sudden they become withdrawn and depressed, and light bothers them. So there are a plethora of symptoms that can manifest as a consequence of traumatic brain injury.
And quickly talk about why early detection is so important.
Sure. So for moderate and severe traumatic brain injury, obviously they're in the hospital setting and we do everything to optimize them clinically. For the mild portion, obviously, patients who have that need to be diagnosed with that and need to get the right attention. Now, if it could be as simple as detecting a language impairment or speech difficulty, so getting them involved with speech therapy would be critical. Sometimes their cognition is impaired, so cognitive therapy, psychological therapy, all these different modalities of treatment are there for the patients to get help and get better and hopefully lead a more functional life.
Yeah, that's always the goal, right? Thank you, Dr. Baker, for being with us today. We'll be right back.